We are live now, Sevan.
All right. Hello and welcome everyone to the third panel of Armenian American Mental Health Association's 2023 annual conference. This conference will bring to our audience awareness on various mental health topics relevant to our Armenian community. My name is Sevan Tahmasyan, and today I'm going to moderate this panel. I'm a licensed marriage and family therapist and currently providing psychotherapy to adults and couples in my private practice in Glendale. And I'm also the AAMHA's board advisory member. The panel session is titled Armenian Couples and Families, and each panelist will have 20 minutes to present the report, and we will allocate the remaining 10-15 minutes for a Q&A session at the end. So I want to ask the audience to make sure to put their questions in the comment section or the chat box on our Facebook page on our live under our live video. And our first presenter today is Yeva Gurjian, and Yeva will discuss about intergenerational trauma and mental health, the invisible impact. And I'm gonna briefly go over Yeva's bio. Yeva is a PsyD candidate, a doctoral candidate, and is currently completing her internship at East Hawaii's Family Guidance Center, a community mental health clinic serving families and youth who have a history of intergenerational trauma. Her clinical experiences include working with trauma, youth, families, and adults. Yeva is passionate about understanding how our psychological history impacts who we are today and how we can make meaning from our experiences by tapping into our true selves. She will be continuing her training at Wright Institute in Los Angeles next year as a postdoctoral fellow and continue serving the community. Yeva, you can take the floor now.
Thank you so much, Sevan. Okay, everyone sees this okay? Perfect. All right, well, thank you so much for that warm welcome. So I'm going to be talking about intergenerational trauma and how that affects Armenian Americans' mental health. And this is something that I think is very near and dear to me, and I think has become near and dear to most Armenians across the world. Our culture has had lots of different collective experiences that have been traumatic, and most of this work is also about how do we move forward from it. We've all been very stuck in this sense of a victimhood identity, and these horrible things have happened, and reparations, this and that. And one of the things I'm going to be emphasizing a great deal on is how do we move forward? And so some of the things I'm going to be talking about stem from my research with Dr. Gribian for my dissertation, and really just emphasizing like next steps and moving forward. I'm going to start off with something Gabor Mate said, and Gabor Mate is a researcher and a physician who studies addiction, trauma, and how those things show up in our bodies as well. And he has this great saying, and I think a really great way of conceptualizing what trauma is. And he says that trauma is not the bad things that happen to you, but what happens inside of you as a result of what happens to you. And so I think of that kind of as a car accident, right? So the car accident is really just an event. It's a thing that happens, but the trauma that comes from it is dealing with the injuries. It's the fear of sitting in a car again. It's your hands getting sweaty when you pass through that intersection again. And it's on us to learn how to deal with our trauma and to make meaning of those stories to really move forward. And when we think of trauma like this as the impact of events that happen to us, we can think of it as something that's intergenerational as well. So intergenerational trauma is thought of as when the consequences of trauma extend beyond the person who directly experienced the trauma, and then it starts impacting the people around them. So for example, within the Armenian community, if we know someone, a great-grandparent, for example, who was a survivor of the Armenian genocide, maybe they had undiagnosed PTSD and had to live with that their entire lives. Their child is going to be raised by a traumatized parent who maybe was distant for most of the time, but if a plate broke in the kitchen, had an outburst because they were terrified. And so living with that kind of upbringing can be very, very challenging and becomes a cycle, because then that person has a child as well. And so parents can sometimes develop neglectful, authoritative parenting styles. They can even project their traumas onto children. And then that person grows up not trusting the world, not having a sense of wonder and curiosity, but really being afraid to explore and to play and to connect with others in a way that can be meaningful. So it really becomes this cycle, and Armenians have definitely become caught in that cycle because of our history that extends way before the genocide as well. And so how can we really break out of that is the question. And that's really the main point of studying it. We want to understand, what is this intergenerational transmission of trauma? What does it mean? And how does it happen, right? Like, what are the mechanisms of the trauma being transmitted? How do we understand that so that we can disrupt those mechanisms and intervene in places to create better, healthier cycles? How can we make meaning from these horrific things that have happened in our community and become resilient? How can we get mental health support? We want to be able to educate not only ourselves and future generations on our historical injustices, but also those of other cultures. And again, most importantly, how can we heal and how can we move on from these things? And so our study was a quantitative study. I looked at how intergenerational trauma impacts mental health in Armenian Americans. And so we studied adults that were all across the United States who identified as Armenian, Armenian American, various generations of immigrants. And we were making sure only to look at intergenerational trauma. And so what that meant was, when we were looking at people whose families had experienced different traumas, for example, like great-grandparents who were genocide survivors or survivors of the Spitak earthquake, we wanted to make sure that the people we were studying, had not experienced any of those things. We wanted to make sure that we're studying the intergenerational trauma and not the trauma itself. And we see these were the different events that we did look at, which isn't completely comprehensive considering the diaspora of Armenians and the various things different, Lebanese Armenians have experienced. There are Armenians living in Iran, Baghdad, etc. But these were the ones that were within our study, and it was measured through this quick little questionnaire. I asked participants to mark all of the following. So if they themselves, a parent, grandparent, great-grandparent, had experienced or was physically there for example, the genocide, the earthquake, the dark and cold years of Armenia that happened in the 90s, and either of the Nagorno-Karabakh wars. Immigration was also a question, but it wasn't something that we considered. We just wanted to make sure we were covering all of our bases. And when we're looking at mental health outcomes, we were looking at depression, anxiety, and stress that was measured by one specific scale. We had a total of 73 participants, which was really interesting because there were about 140 people who completed the survey. But of those 140 people who completed the survey, just over half of them had not experienced any of those events. So what that means is almost half, so maybe like 30% of people who completed the survey had directly experienced one of those traumatic events, which I think is just very interesting in context, right? To say it is very important for us to study these things, because even people in America, we've immigrated here, it's still something that's affecting us currently and will continue to affect future generations if we don't intervene and disrupt that cycle. 52% of participants were adults, so 25 to 34, younger adults, millennials, almost 70% women, and 60% were second generation. So I think these are just some of the interesting things of the demographics. And so generally, we're asking this big question of whether intergenerational trauma can impact emotional well-being. So we looked at anxiety, depression, and stress, and we found a statistically significant relationship with intergenerational trauma and all of these different outcomes of mental health. So what that kind of means in a nutshell is that the more intergenerational trauma you have, or a person had endorsed on this study, so a great-grandparent who was a genocide survivor, a parent who experienced the Spitak earthquake, and a parent who experienced the dark and cold years, the more of those events that a person has in their like psychological history, the greater chance they had of having higher levels of anxiety, depression, and stress. So what that means is that these are all still problems that we're facing as a community who have immigrated. We've started lives in a different country, but these are things that continue and will continue should we not intervene or find different ways to really heal and address these problems. So now what, right? This is the big question. It is so important for us to understand our roots, because when we understand our roots, we can almost say that there's this framework of a predisposition to poor mental health. And sometimes that can be a validating thing, and sometimes that can be a thing that can feel hopeless. But sometimes it can help us reduce that self-blame and understand that there have been certain things that have stacked the deck against us. And it's going to take work and addressing these different issues to be able to empower our community to move forward. And every single person, I love this little picture. It says that every person you meet is either repeating a cycle of generational trauma or is carrying the burden of breaking cycles. I wouldn't necessarily call it a burden. I think it's a lot of hard work, but it is a responsibility that I think we have as Armenians who have these resources to be able to understand these are things that have happened to us, and it does make it harder for us to be psychologically well and to have these meaningful lives. There have been research that has shown that young Armenians across the world, not just in the United States, are really trying to move away from this identity of victimhood, especially since other research has also shown that Armenian Americans hesitate to pass down their culture because of the implications of helplessness and victimhood and weakness that kind of come with that. Where, you know, I'm sure there are people listening who, growing up when you're around 5, 6 years old, you were told the story of how your great-grandparents or whoever survived the genocide. And what a thing to tell a small child, and what a thing to really shape that growing identity. And that can kind of create that sense of helplessness, and we still haven't gotten the recognition, and we're still fighting this fight. So how do we move away from that into meaning from these terrible experiences, right? We have that saying that they tried to bury us, but they didn't know we're seeds. This is our chance to grow, and we talk so much about post-traumatic stress. What we don't talk enough about is post-traumatic growth and the resilience that comes from those things. So to kind of do that, some of the things that I'm kind of emphasizing and encouraging are, first of all, open dialogue about your history, about how these different things have impacted your family, your upbringing, and maybe even your mental health now. Embracing our stories and embracing ourselves as a community to be able to share those stories and kind of find some kind of resolution with one another. To have empathy for the fact that the way we have dealt with these traumas may not have been the best. Sometimes families have become very enmeshed. Some families have become very separated as a way to deal with these things, but having empathy for the fact that we've all done the best we can, and so have all of our families. Emphasizing collectivism, so remaining united despite political issues that are continuing, and differences that we have within the diaspora. And most importantly, resilience, which also means being open to mental health treatment and being open to asking for help when we see ourselves struggling. A really big piece here is attachment and family. A lot of research has shown that not just within Armenian Americans, but whenever there is intergenerational trauma, a secure attachment style is a protective factor for the poor mental health outcomes that come with it. So what that means is we can have had all of these really horrible things happen in our past and in the past before our past, but if we can have good relationships with one another, if we can trust one another to meet our needs and to meet one another's needs, then it's a huge protective factor for ourselves from the mental health outcomes that can come with that. So as clinicians, something to kind of emphasize healthy communication styles within families, raising children to be able to explore comfortably and to know they can always come back to their parents who are going to be a safe base. And last but not least, to embrace our culture fully. And what that means is dancing our dances, eating our foods, reading each other's coffee cups, and just being able to preserve and promote our language, our values, the things that we have fought so hard to preserve, to make sure we're actually doing it and to thrive off of it. I think that these are all things that can get really caught up in the mix as immigrants, but still things to really emphasize that this is what we fought for. These are the things that we have really, these are the things embedded in our culture and the things that should continue to thrive in the face of all the adversities we've experienced. So thank you. That's all I have.
Thank you, Eva, for your great presentation. It was really interesting. I want to use this time and again remind the audience to write down their questions in the comment section under our live video on Facebook. Now we'll turn our attention to Dr. George Garibian, and I'm gonna go over his bio. Dr. George Garibian has a doctoral degree in counseling psychology from the University of Memphis and a master's degree in marriage and family therapy from California State University, Northridge. He is a licensed psychologist in the state of California and provides psychotherapy in a private practice setting. In addition, Dr. Garibian is a core faculty member in the clinical psychology PsyD program at the California School of Professional Psychology in Los Angeles. His teaching and research interests include intercultural psychology, immigration and mental health, clinical intervention, trauma, mindfulness, and family dynamics. In addition to his bio, I should add that Dr. Garibian also is the AAMHA's Education Committee Chair, and without his passion and dedication for Armenian community, these annual conferences wouldn't have been achieved. He organized AAMHA's first international conference in 2021, and today we're conducting the third annual conference by his guidance. And Dr. Garibian's topic will cover immigration and Armenian American families. Without any further ado, I'll let you take it away, Dr. Garibian.
Thank you, dear Sevan, and I appreciate your kind words about me, and I am not alone in doing this conference. It's like with help of yourself, our other board members, and our great presenters like the ones we have here. So I'll start my presentation, which is on immigration and Armenian families. So as Sevan said about myself, about the work that I do teach at Alliant, the California School of Professional Psychology, and one of the courses that I've been teaching in the last few years been the immigration and mental health, and I also taught the intercultural courses. And I'm very much interested in the studies on the research on topics related to immigration and acculturation. So what I'm going to present is based on what I've learned from the research from my students who done studies on different cultures, immigration issues, Armenians, like the one that Yeva just did. So this will be a summary of all those research studies and what I've learned from the theory. So today I will cover topics related to causes of immigration, the issues related to pre-migration, migration, post-migration, acculturation issues, intergenerational acculturation gap, and I will end the presentation with issues related to Armenian families, gender roles, and like some suggestions about the immigration issues and the family dynamics. So first, it's important to, when we're thinking about immigration, to see to think about or learn about the causes of immigration. Armenians, other communities, they migrate for different reasons, but some of the main reasons that people migrate to a new country is for having better financial opportunities. They may be escaping persecution. They may migrate because of wanting to have a better life opportunities, such as education, but also some people migrate because they want to be joining to their family members who have already migrated. And these causes, they can be different, and the differences can make a difference regarding to their migrants' experiences in the new country, in the US in this case. And because different causes, they lead to different motivational experiences. And I will talk about that in a second. So when people basically start to be aware and have either this, we call it push factor or pull factors. There are push factors, meaning that people are being pushed away from where they live. And there are pull factors, that means that there are great opportunities, good things in the new country that pulls the immigrants. And when people become aware of these push and pull factors, then the question is about whether they need to make that decision to migrate. And this decision is not done easily. People may go through this decision-making process for years to become emotionally ready. But also, in order to make the decision, people need to make this judgment related to whether they can make this journey. And not everybody has similar, the same type of resources or preparation to make this journey. Financial resources, education about the new country, about the process, the way that they can actually make the journey are important. Mental health and resiliency also been known is important. People who are able to make this journey usually are people who have at least the ones who become more successful and have less stress after their migration. They need to have certain kind of resiliency and less mental health stress and problems in order to be able to be successful when they come to the new country. And going back to the link between the causes of migration and motivation, it's very important to understand, for clinicians, for families, to know that because migration, it can be a very life-changing and challenging process, people's motivation related to migration is very important. The more, in general, the more motivated migrants are, the better their life and mental preparation is going to be to manage or handle challenges. So that's basically the issues related to pre-migration. And then when people make their decision to migrate, then they have this different experiences that they can have. Some people, when they go through this process of migration, they may experience a lot of stress. For some, unfortunately, the stress can be even worse, and they can actually experience traumas. Like we know, and I know many of our people from the community know that we hear stories like when people migrate, they can go through very serious problems, like including being held up, losing family members, sickness, imprisonment, and so on and so forth. And this process basically can also make a big difference for migrants' experiences when come to the new country. If there is more trauma, more stress during the process of migration, they may have more difficulty to basically adjust to the new country. And for clinicians, families who want to understand their experiences, they also need to consider that what happened to them when they were actually coming to this country, the process of moving from Armenia, Iran, Lebanon, and other countries that Armenians come from. And in general, we also have this idea of resiliency. The higher individuals' resiliency, that it can be basically interpreted as their mental preparation, their way of coping, having better coping mechanisms, skills, those things, social support can help individuals to have a better migration process. And what happened is that when people come to the new country, to US, then we have these post-migration issues. We have the big question is the adjustment. Some people have better knowledge, education, awareness, exposure to the new culture. Some have less, and some have the closer or a more or better expectations what to expect from new country. Some don't have realistic expectations. They may think that like things are going to be very different than what actually in reality things are. And this adjustment, again, it's going to be a big major challenging process for most people. For some, it actually is going to be a motivating factor. Some people, the stress is not a negative stress when they are coming to a new country. It can be a motivating factor to succeed, to take advantage of the opportunities that exist in the new country. Support system, social support, been known that can have both the positive impact and negative impact. The positive impact for immigrants of like having social support would be that they can receive emotional support. They can be supported through like receiving information, being exposed to, or receive opportunities for them to have jobs and other resources. But the limitation or negative aspect of social support or social connections would be social support usually been known that migrants who live in enclaves of cultural enclaves, they are being receiving a limited level of support and resources, because every closed community basically they have a limited resources, and if people get used to the level of support or resources only what exists in their community, they may also have a difficulty to wanting to get outside of the community, outside of their support system, and receive more opportunities. So it has this ceiling effect that stops immigrants to grow after a certain level of progress. So some other challenges that can be very stressful, and we know stress can be have an accumulative effect, like it would be the residency process, people's legal status to stay in the country or not, and going through multiple processes of getting the green card, the citizenship, and all of those things can be a big challenge. One other thing that is specifically we notice very important within the Armenian community is the ethnic identity. We know, like as Yeva talked about, like we have experienced this historical, cultural, ethnic traumas. The big one being the Armenian genocide, and the need to keep the Armenianness alive in order to basically revenge, or maybe revenge is not a good word, but to receive the justice that we are looking for, it basically requires to keep that Armenian ethnic identity strong in order to get what we want from the perpetrator, from the history. So ethnic identity can be a big issue for many migrants in Armenian migrants in U.S. and there will be, for some, will be a challenge to understand how to navigate their to keep an Armenian identity at the same time to have a new identity, American identity. So for that, which is the kind of like the process of acculturation, we also see that some people experience acculturation stress. Acculturation stress been known to high acculturation stress been known to increase mental health problems. People with a lot of issues regarding to how to adjust to the new country, they may have high level of stress, and that can impact their mental health, increasing the risk of having depression, anxiety, and things like that. So acculturation can be this process of adjusting to the new culture, and there are multiple areas of life that people can or will need to adjust. Learning the language, economical issues, and also to navigate the values and the culture that they have, and the ones that the dominant culture, the American culture, expects them to have. And that's basically another issue that the research, the theory basically explains different strategies that people may have. Some people may want to basically to assimilate completely to the American culture, meaning that they don't want to keep the cultural values of their own, the Armenian culture. They want to only adhere to the American culture. Some immigrants may have the opposite. They may want to not have anything to do with the American culture and hold on to only the Armenian cultural values. And the research says that migrants have less emotional mental health problems, have a more resiliency if they can have this bicultural strategy, which is an integration between the heritage culture, the Armenian culture, and the American culture. So then we have this issue of different level or different ways of acculturating amongst parents, older generation, and children. There is this concept is called intergenerational acculturation gap, which explains that how parents and children of immigrants, they can acculturate differently, and there will be a gap between their cultural experiences. Not always, but usually parents are they are adhering more to their heritage culture. They want to keep the old values, old traditions, and the younger generation, both because of their age and the years being in the new country, they are more exposed and more adhering or willing to adhere to the new culture, the American culture. So that can basically create some kind of a conflict or some kind of tension. Parents sometimes we notice in clinical work or in studies that they may be worried that they're losing their children because they have new culture, they don't understand them, and they are worried that that will impact their own identity because their hopes of their children continuing their tradition is threatened. And that's also we will see in marriages, in relationships, and I know Dr. Manvelian will have a talk about that, so I'll not go in depth on that. But these are different areas of acculturation gap and intergenerational acculturation gap that can create pressure and stress amongst families. And you see sometimes in clinical work, parents may be worried, anxious, depressed because of this misunderstanding. So amongst themselves and their children. One other thing that you will see is the children's experiences in the new country. They would be asked or pushed to succeed in the new country, and that would mean that to learn the American values, the cultural expectation in order to be able to succeed. But that itself can actually be also threatening for the families, because the more children want to succeed, the more they become different than their parents. And for some families, that can be problematic. I know we had a talk earlier, talked about individualistic and collectivistic cultures. We know that in US we have this individualistic culture, which means that people are encouraged to be successful on their own and not to be thinking too much about their family members' experiences because of their own changes and success, compared to a collectivistic culture, which is for more Armenian cultures, and some other Asian and Hispanic cultures are more collectivistic, which is a culture that values group and family success as being something interrelated. The individual is not encouraged to only think about themselves. So these differences between Armenian culture and the expectations of US culture will be perhaps also causing some kind of a tension, and we need to be aware of that as well. But the good thing is that we know that families, if they have good communication and good relationship, good dynamics amongst themselves, these issues can be resolved. They can discuss these things and resolve and understand each other and reduce the worries and threats of the family, the parents, and then also help the children to understand that it's okay to adhere to American culture, but at the same time they can also adhere to Armenian culture in certain areas, and have a more integrated approach to their acculturation. So this will be my last slide. I know we only have 20 minutes, so I'll make it fast. We also have noticed when you look at the families, when migrants come to a country which has more equal expectations or equal gender role experiences or values, and Armenia and countries which most Armenians are coming from, usually they come from more patriarchal countries, and when they come to a new country, there will be usually some families you see some tension amongst the couples, and you see males may also have made difficulty to perhaps finding a job to be the sole provider of the family. At the same time, males may have a more freedom, more opportunities to work, and a higher, basically, status in the family, being another provider. And this can actually create this tension, the changes of this from the old relationship and expectations of each other, from the partners from each other, to a new gender role. And this again can be an area of tension, and if the couples, the families are not able to address these issues, then you will see the problems may increase and be transferred to children and the entire family. The final point I will make is that We also have some research that says that families who have more conflicts among themselves, their children sometimes also become more assimilated to the American culture, because it would be a coping or escape mechanism from being away from the families and being more wanting to get anything that is not Armenian, anything that is different than what their families have. And this can be also a tension, creating some tension amongst the family. So, but again, if the family understand that their children's behaviors are also somewhat related to what they experienced amongst the couple, the parents, then they can also resolve some of these issues. So this will be the last point that I wanted that was my last point I wanted to make, but I'll be happy to ask questions at the end. Thank you.
Thank you so much, Dr. Garibian. Thank you for your presentation. It was an amazing presentation. And again, I want to remind the audience, if they have any questions, feel free to put them in our comment section under our video. It's a live video on our Facebook page, so please make sure that you put your questions there. And at the end, we will make sure to go over them and to cover them. Now we're going to turn our attention to our third, last but not least, presenter today, Dr. Atina Manvelian. And I'll go over her bio. All right, Dr. Atina Manvelian will be joining Santa Clara University this fall as an assistant professor for the Masters in Counseling program. Dr. Manvelian earned her PhD in clinical psychology from the University of Arizona, where she specialized in interpersonal relationships, health psychology, and intervention science. Dr. Manvelian is a postdoctoral fellow at Stony Brook and Stanford University. As an intervention scientist, Dr. Manvelian designs scalable, evidence-based interventions to promote healthy relationships and psychological well-being. Invested in expanding access to mental health care for Armenians, Dr. Manvelian is currently working with members from Yerevan State University to upgrade their curriculum and create licensure standards for therapists in Armenia. And Dr. Manvelian's topic for today is going to cover intercultural marriage in the Armenian American community. Dr. Manvelian, the floor is yours.
Thank you for the lovely introduction. I'm going to take a moment to share my screen. How does that look? Awesome. First and foremost, I want to thank everyone for inviting me here to speak. It's always such a pleasure to be among other Armenians that are so distinguished and doing such amazing things to support our community. My interest in intercultural marriage actually began when I entered into an intercultural relationship, and I want to personally self-disclose that because I think it can be helpful for some people to have someone in the community that's a resource on this topic, that's not only familiar with the research, hasn't only helped other people sort of walk through some of the challenges of navigating intercultural relationships, but has also personally experienced one herself. And we are married now. It's been 12 years, so I'm open to all sorts of questions. I want to start first and foremost by just defining some key terms for us so we're all on the same page. So when I say intercultural, I'm really talking about two people from different cultures. So this is the umbrella term to describe a couple, for example, that is from two different races, ethnicities, two different backgrounds, religious backgrounds. And under this umbrella term, we have couples that are also interracial, So a couple that may be Black and white. I think a lot of Armenians, we sort of have to mark the white box. Many of us are characterized as Caucasian or white. And also interfaith couples. So these are couples that come from different religions. Although there isn't any research really on intercultural relationships within the Armenian American community, when we look at intercultural marriage in the United States, we see the trend, and the trend is very clear. It is increasing over time. So if we look at specifically interracial and interethnic marriages and relationships, in 1960, it looks like of all marriages, about, I want to say on average, 4 to 5% were interracial or interethnic. And now near 2017, it's around 18%, 16%. And now it's 2023. So I predict that the trends will continue to rise. And the reason for this is that we're really seeing changes in the way that our societies work because of increases in technology, social media, online dating. We are more mobile as people. We don't necessarily go to school, work, and live in the same cities. We're surrounded, at least in the United States, by a lot of different cultures, a lot of diversity. And so we are making more and more contact with different kinds of people, making it more likely that we may fall in love and decide to marry someone outside of the Armenian culture. One question that I had is, well, when we look at the research, what do we see? Even if there isn't research on Armenians that marry outside of our culture, what about other intercultural marriages? Are they more or less stable? And there's sort of a commonly held belief that intercultural relationships are sort of at high risk for failure, that they have more divorce rates, lower levels of marital satisfaction. And even though the studies are limited, the research actually suggests that maybe the opposite is actually true, that interracial marriages and interracial couples actually might experience higher relationship satisfaction on average and around similar levels of conflict compared to those who choose to marry within their race. So when it comes to the Armenian community, how are we supposed to think about intercultural marriage? Is it an opportunity or is it a threat? And why does marrying an otar, why does marrying outside of our culture feel so threatening for our community? Why does it bring up such strong emotions, reactions, and opinions? To really understand and be able to answer this question, we have to take a look at our history. And like so many of the other presenters have beautifully articulated, our history is fraught with war, with genocide, with immigration. We have been a people that have had to fight to survive. And in many circumstances, we've barely made it out. And so from my perspective and from my read on why we sort of push Armenians to marry other Armenians, it is to preserve the Armenian culture. And it is to, beyond the fact that you may speak the same language or share similar traditions, that it may be easy. I think the sort of historical context is that we have almost disappeared as a people. We almost lost our language. We almost lost our cultural traditions. And so the smallest sort of, the family unit is the smallest and maybe the smallest way that we can make the biggest impact, right? In marrying someone who's maybe Armenian, maybe we're able to preserve that culture. Maybe we're able to preserve our language. It's difficult though, right? Because sometimes we fall in love with people who are not Armenian. And sometimes that can be a really exciting, fun thing. but it comes with challenges. So I want to review some of those challenges. And that is that, first and foremost, I think almost any Armenian will say, you know, what are people going to say? What are people going to think? Whether it's a parent or the child themselves that has fallen in love with someone else or has decided to marry someone else, there's always a concern of whether or not we're letting our culture down, whether or not we're letting our ancestors down, right? There's these big sort of existential issues. And another challenge may be language barriers, right? If you're sort of mixing with someone from a different culture, you may not always understand their family members. Other people may be speaking in a language that you're not familiar with. So there may be some difficulties with language. There's also just different cultural traditions that people have to navigate. And the couple has to navigate this, but also the families have to navigate this around the wedding, around child rearing. There are different ways in which people go about things. And if you're not from that culture, there is a process of sort of really having to reflect and learn, you know, what are their practices and how is it different from mine? And how are we going to come together to really sort of meet in the middle or compromise? There's also a lot of benefits, and I think we overlook many of these benefits. And that is that sometimes you choose to be with someone outside of your culture because there's an amazing personality fit and your compatibility is really, really strong in a lot of other ways. You may also experience higher relationship satisfaction because of that fit and that compatibility. I think the opportunity, I think there's an opportunity also when you marry someone outside of your culture, outside of the Armenian culture, not just to learn more about their culture and their tradition, but also teach them and their family about Armenians and about our cause and our culture and our traditions. And in a way, I've found, at least personally, that can help expand the Armenian cause. That is, that it's not just now Armenians that care, it's other people from other cultures that also care. You can also take advantage of the fact that you may speak different languages and learn one another's languages. There's many examples of this. You know, there's people in Armenia that are Black or come from a totally different race, and they have learned the language and they've assimilated, and they feel and are Armenian in many ways. So I think there's definitely an opportunity to not shut people out, but rather invite other people into our culture, and to really expand the Armenian cause. When it comes to working with people, either couples or families that are managing these intercultural relationships, I wanted to share some of the process that I go through, and with the hope that it may be helpful in helping you navigate these relationships, or if you're a therapist or mental health practitioner, that it may help you work with clients who are experiencing some of these issues. First and foremost, I like to clarify, you know, what are people's goals? What are their values? Are there differing values that are sort of part of the issue? And what is the historical context, right? You want to also understand, for the person that's Armenian, you may understand their historical context and cultural context, but for the person that is not, really taking the time to understand, what does it mean for you to marry someone who's Armenian? What does it mean for your family to marry someone who's Armenian? What are some of the stereotypes, right, about each other's culture? So really taking the time to get the lay of the land. And then I find that inevitably there are so many fears that come up. Fears around losing the culture, fears around what other people will say. You know, how will the children be raised? Am I going to lose my family? I'm going to lose my son or daughter because they didn't marry someone who's Armenian. They're not going to understand me. We can't get married in a church. There's all sorts of issues that come up. And I think really slowing down to help people understand why this feels so threatening and why it's hard to accept, and starting to identify and reframe some of those fears, trying to understand if they're really true, right? And this is where I like to invite other family members into the session so that we have sort of all the parties present, or even two people at a time, to really improve the communication. Sometimes we have these fears inside our minds, but we're not communicating them. We're not asking if they're true. We're not asking the right questions. So really helping people reflect and then reach into themselves and find the courage to communicate to their son or daughter, hey, I'm afraid I'm going to lose you. Right? Is that true? I'm afraid you're not going to teach your children Armenian. And I immigrated to this country and I worked my hardest to try to preserve our Armenian identity. Will you help pass that on? Talk to your children, talk to the partner. And as kids, you want to start to open the dialogue help your parents have some of these conversations if they can. And this is a wonderful reason to also seek therapy, to create a safe space to have some of this dialogue. I'll also work on strengthening some of their communication skills. So sometimes when we're really emotionally heated, it can be really hard to express ourselves in a way that invites other people in. Rather, we may come off as really aggressive or really emotional, and it may actually push other people away, or we might just completely shut down and not want to talk about this topic at all and just avoid the topic, avoid the relationship, avoid your parent or your child. And so I think it's important here to really help people regulate their emotions and learn to connect, so that just because there's an intercultural marriage or an intercultural relationship happening, we don't want that to erode the family, right? We don't want that to disconnect people from one another. And I think that's what I work the hardest to do, is to keep those lines of communication open, so that even if it's hard for you to accept, or even if it's hard for you to understand why your parent can't accept this, to really say, I'm going to value the fact that we still have a relationship, and I'm going to do my best to work around this. I'm going to do my best to preserve my relationship and what I want, but at the same time, trying to understand what my parents want, and vice versa. Last, I always encourage people to maintain their boundaries. Sometimes Armenians can be very enmeshed in one another. And I think one of you was mentioning that, sometimes we feel like our children are an extension of us, and what they do is a reflection of us. And I've heard clients say, did I fail as a mother because my child is choosing to marry someone outside of the culture? They see it as a reflection of them. So really helping them maintain boundaries and autonomy, and really allowing people to make their own choices, and helping people accept that can be difficult, but it can be very rewarding at the end of the day. I want to thank you all so much for your time. I'd love to answer any other questions or comments, and I'd love to stay connected to any of the Armenians interested in connecting with me. I talk a little bit about some of this work on my Instagram, so you're welcome to follow me there. And if you're interested in working with me for individual, couple, or family therapy, feel free to reach out and contact me. Thank you so much.
All right, thank you so much, Dr. Atina Monvelian. And thank you, all of you. I believe as I was hearing your presentations, I could see some overlapping topics, which was great. And I think we have two questions, and I think at least one of them, two of them, both of them can be discussed by any of you. But the first question is directed towards Yeva Gurjian, and I'll read the question, and I'll give some time for Yeva to respond to that question. So one of our audience asked, I was wondering whether you looked into the probability that higher scores on this scale were related to intergenerational trauma or being second generation representatives.
That's a fantastic question, especially since 60% of our sample was second generation. I think it could be possible. It's not something that I actually looked into, but would be very interesting to see. So the part that I presented on was just some of the things that we looked at for the study, and some of the other things were other variables that are related to intergenerational trauma. So things like PTSD symptoms. Research has found that whenever parents are traumatized and have PTSD symptoms, their children are likely to show symptoms of PTSD without having had a traumatic event. So that's one of the things that gets transferred. And the likelihood of developing PTSD is also increased after having a traumatic experience. So those are called secondary traumatic stress symptoms. And we did see a significant relationship between intergenerational trauma and the PTSD symptoms as well. So there have been like a couple of things that we were looking at with this study, and this was just one of them. And I think it's a really good thing to also look into. I think just the fact that there were 60% second generation participants was just kind of quirky and interesting in and of itself. So I think it's a great question and definitely sparked some curiosity.
Thank you for your explanation and clarification, Yeva. And I want to take this time to remind the audience, if they have any questions, feel free to write your questions in the comment section. And we still have a little bit time to go over those questions. And our second question is, oh, before I get into the second question, would you, Dr. Manvelian and Dr. Garibian, would you like to add any comments to Yeva's clarification?
Well, maybe just like, yeah, as Yeva said, it's like second generation, the participants were mostly, or all of them were second generation. And also like second generation immigrants, we know that they also experience a lot of stress themselves. And that can be also a little bit different than maybe first generation immigrants. So first generation immigrants have this, like we have this, something is called immigration paradox or acculturation paradox. Is like, I think it's immigration paradox. I forgot the exact term, but it's like the first generation, even though they may have more stress, but they're also more successful, more resilient to deal with the issues compared to second generations. That is like can be maybe also an issue with impacting them and having higher level of stress and trauma.
I appreciate that, Dr. Garibian. And the second question is for you, Dr. Garibian. So here's a question. As Dr. Garibian mentioned, that stress is a cumulative phenomenon. Do you think the frequency or quantity of migration for an individual has its role to create higher level of anxiety and stress among us Armenians? For example, 4 centuries ago, our ancestors migrated from Armenia to Iran's villages, then another migration to capital of Iran, then another migration to Europe, and finally to the USA. And I can very I resemble with this question a lot, so I'm really curious to hear your explanations.
Yeah, no, great question. And I think we kind of hinted at this like in maybe in my presentation and some other presentation, but the answer is yes, definitely. Stress is a factor that can be accumulated. Like if a person is experiencing stress in their job, and then they have stress in their relationship, and they have stress with parenting and things like that. So these stressful events, if we want to understand them, we should not look at them just individual events. We should look at them like stress is being accumulated. Like it's not that one forgets about their job stress and then they come and they have stress regarding parenting, regarding a relationship. So similarly, I would say that migration, multiple migration from one country to another country, in one generation, definitely we can see that can actually, if the previous migration experiences, the stress is not resolved, it can be added or be impacting, negatively impacting the current migration. But when you think about the multiple generational experiences of migration, and then that's perhaps something that what Yeva's study is about, like it can be having this negative impact, like intergenerational impact, like parents may have still experiences of from their ancestors with like unresolved issues of the migration, and then the second or third generation need to migrate again. So it can basically it can be both positive and negative, because we also trauma and stress can be also a good opportunity for us to grow and learn different skills. But for some people it can be also problematic if they don't know how to deal with the stress. So it can be both positive and negative when you think about intergenerational issues, intergenerational traumas or immigrations.
So it can raise this traumatic symptoms, but at the same time, it could be both positive and negative.
So yes, if people learn how to process the issues, the challenges that they've experienced, we have this thing is called post traumatic growth. Like people become even stronger, wiser after certain trauma experiences. So if our ancestors have learned, some of them, I'm sure they have learned that how to process their migration experiences from Armenia to Iran, perhaps those individuals, children, and the offsprings, they will have a more resilient experiences or more resiliency. But it could be also some individuals who were not able to process these old issues of their experiences in Iran and from their ancestors' migration. So the offsprings of those individuals may also have more problems. So the short answer is perhaps it's complicated, but it can be both positive and negative.
For sure. And I think it varies, and it can have different variables, and it can depend on a lot of factors. But I appreciate your explanation and clarification. There was a question that someone asked if this is recorded. Yes, it is recorded. You can definitely watch it as many times as you want, and you can share it if you want with your loved ones. And I have a question from Dr. Atina Monwellian, and it is about therapists. As clinicians, when you are in your practice and your client comes in, but let's say your client's values are different than his or her or their parents, then how would you approach that? How would you encourage the reflections and communications in such situations?
Yeah, I think it's a really good question, and it's very common, right? That different people of different generations have different values. I think first and foremost, I want to understand what's important for them in trying to maintain a connection with their parents. Some people will say, I don't care at all what they think, right? And we want to figure out, is that a balanced way of looking at this? Does that make sense? What kind of parents do they have? What are the parents' values? How different are they from theirs? So I think for me, the importance of relationships and connection and maintaining family ties is imperative for our psychological well-being and even for our physical health. So I will always try to help people see eye to eye. But there are certain situations in which parents are being maybe too strict or too restrictive, or sort of pushing their child away. And so there are certain situations where you simply have to set up some boundaries and protect yourself, especially if they, you know, border sort of being more abusive and highly critical and things like that. Yeah. But it's a very delicate topic to navigate. It's a very sensitive topic to navigate. And, you know, I've had people come to me and say, am I a racist? And it's, you know, my child is telling me I'm a racist. Am I a racist? And it's, you know, you have to sort of manage these things in a very diplomatic way, and in a balanced manner. And you don't want to push people out of therapy or make them feel really bad. And maybe we all have experienced or have internalized some racism at some point, right? So really helping people discuss this in a way that doesn't shame them, and isn't shaming each other, I think can be really helpful.
Yeah, I think navigating this water can be a little bit tricky, making sure that no one is offended, shamed, and definitely requires some skills. But thank you so much for your explanations. I, for the last time, checked the Facebook live video, and it seems like that we've covered all the questions. And I just want to make sure that I transfer the many thanks and appreciations from our audience. And I want to personally thank all of you for your knowledge, for your wisdom, and bringing light and awareness to our community. And we hope from AAMHA, on behalf of AAMHA, I hope that we can see Dr. Monvelian and Yeva next year in our conference again. And hopefully Dr. George Garibian will also be part of the conference. And I want to take this time and appreciate all of you and our active audience as well. Thank you so much. Thank you, presenters, for spending your time preparing and dedicating your time and bringing your knowledge to us. I also want to make sure that I use this time and mention that if you are interested in our association and if you would like to support our mission, please consider becoming a member in our association. And at this point, you may be a clinician or not to join our association. So if you're feeling that you're resonating with our mission, feel free to go to our website, AAMHA and Armenian American Mental Health Association, and make sure that you become a member. And there's another session coming up, and that panel is going to cover the psychological assessment by Dr. Monica Babayan. So I want to ask our audience to stay tuned and stay here for a few more minutes to join the next panel.
Sorry, Sevan, it's also Dr. Rene Karamians will do a presentation as well with Dr. Babayan.
Dr. Babayan and Dr. Karamian.
Yes.
My bad. Yeah.
No worries.
So we have two panelists. Stay tuned, and they will cover the topic of psychological assessments. Thank you so much, everyone. You have a great night.
Thank you.